This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome two guests to the program, Lynda Chiotti and Janet Iles. Both are team leaders for the SPECS program and board members for the Community Waterfront Heritage Center here in Owen Sound. Today, we're going to be talking about a really innovative program new to our area, but not necessarily new to other areas, that is social prescriptions engagement for culture for seniors. And I'm sure they'll even be able to say specs even better than that when they're doing this program. But it captured my attention about that social prescription. I think of medicines and other types of prescriptions, but we're going to talk about social prescriptions. So welcome to both of you. I am delighted you're on the program today.
Thank you, Carol. It's a pleasure.
So I want to thank you for the speaking notes and bullet points, but I am really counting on both of you to take this program forward. So who'd like to go first and talk about Social Prescriptions Engage Cultural Seniors Program? I think that's the full name, actually.
Indeed. Well, perhaps I'll start. Sure. Social prescribing as a concept, it is not brand new. It's being done all over the world and even in some provinces of Canada in a limited way in Ontario. But to our knowledge, it has never been done officially in Owen Sound. So the Community Waterfront Heritage Center saw an opportunity to try this out. This is a pilot program. It's quite limited in scope, but we are adhering to the suggestions of the World Health Organization in implementing it. And we're learning a huge amount. We're basically, as social prescribing does, we're endeavoring to connect seniors in Owen Sound who perhaps are feeling lonely, isolated, disconnected, and we're trying to connect them to community events, particularly cultural events, based not only at the Waterfront Heritage Center, but we're also partnering with Billy Bishop Museum, Tom Thompson Gallery, and the Owen Sound and North Grey Library.
Excellent. Now, this takes money, obviously.
Yes.
Tell me where the money comes from. How did the Waterfront Heritage Center get money to do this?
Okay, maybe I'll explain that since I was involved right from the beginning. I'm treasurer at the Community Waterfront Heritage Center, so part of my job was to do the application with some help. I didn't do it all on my own. And we heard about the New Horizons for Seniors funding. They do funding for different types of projects throughout the year. And so it comes through Underemployment and Social Development Canada, but really we focus on New Horizons for seniors. So the idea is that seniors are involved with seniors. So the intent is that some of the leadership, or all or most of the leadership, are seniors. It's not limited to that, so our curator certainly is not a senior, so he can be involved. But the idea is engaging other seniors. So we're considered cultural seniors, so we try to engage other people in lots of fun events.
Yeah. Now, you have to clarify for me, seniors, what age are we talking here?
Okay, I think what is being accepted is 55 plus.
Okay, so.
But if somebody's 54 and 9/12, we won't care. we don't ask them how old they are that precise.
You don't make them do an age test or anything.
Yeah.
So this is a pilot project through funding that you have through a New Horizons grant. And for how long will the pilot go on?
It's only for 1 year, and it began at the end of March.
Okay.
But the first couple months were really us learning what really was involved.
Okay. So take me through how it unfolded. And I understand that it's about referrals. You know, it's a referral type of program for a social prescription. So walk me through as you got the funding, what happened with the program? How did it grow and develop?
Well, we had a launch event in the spring, at which time we obviously engaged with and communicated with the other organizations in this city. It's a very culturally active city anyway, so the obvious first start was to letting people know, organizations know that this existed, because one of the fundamental ways that we execute on the program is to have events, cultural events, that are appropriate for our clients. After the initial promotion, marketing, and, here's what we are and what we're doing, we then moved on to the idea that in order to make the program happen, you need trained people. And the training happens for a role called link workers. Now, these are people who undergo the training, but they're not medical people. I have no medical background whatsoever, but I am a senior and I've undertaken the training. The link worker makes the first contact with the referred person. Okay. The referrals can happen. We've had several people self-refer. When they hear about the program, they think, that would suit me just fine because I'm disconnected from my neighborhood, or, in some cases, Carol, there are people who undergo major life changes, such as losing a partner, or perhaps major medical events, especially at our age. And they can get over that. They can be treated for that medically and sort of get through the hard parts. But then they look around and they say, what happened to my neighborhood or my connections? Or perhaps they're new to the area. They have no connections. So with the SPECS program, if they can get a referral, either through themselves or through any of their medical providers, then myself or another link worker will phone them up and have a chat. And the idea is that we'll find out their situation. Perhaps we definitely ask very specifically about their interests. Do they like country music? Do they like art galleries? That kind of thing. And perhaps any of their specific challenges, because we don't want to suggest an event that they couldn't get to or that they're really not interested in. So that's what the initial intake conversation is about.
Yeah.
After that, we maintain contact, generally through email, and we also have a publicly available calendar of events that we feel are appropriate.
So you're really a connector. You connect.
Yes,
and by even that first phone call, you communicated and connected people to the community around them. So it begins with that first call. Yeah.
Yes, exactly.
So I have more questions. So you sort of do an intake where you find out more and you offer a menu of choices that you think of options, sort of matching people to what's available.
Exactly. Yes.
And then do they actually, they're responsible financially for engaging, like if they wanted to take something in culturally that had a fee, they're responsible for that fee, or how does it work?
I'm glad you brought that up, Carol, because the intention throughout the program is that any event or opportunity that's offered is either free or low cost.
Okay.
Because we feel that's important to be inclusive and available to everybody. There is a limited amount of funding that we can help with within the program. For example, we can offer an honorarium to people presenting for us.
Yeah.
We've had some really events planned and have happened already, such as, we've had a drum circle at the Waterfront Heritage Center, that kind of thing. So, and we want to be able to support the presenters but as you can imagine, there's limited funding. However, we do seek out those events that people can experience and enjoy without cost.
So some of the information you shared with me, it talks about social prescribing as connecting, and you mentioned individuals with non-medical community-based services
Yep.
to address the social determinants of health, such as loneliness and isolation. And your goal is to improve the health and well-being by strengthening community connections and addressing unmet social needs. Now, my experiences with pilot projects is you have to prove it. You got to measure it, especially if you want to appeal for additional funding. How do you measure what you're achieving?
We've undertaken to try and have some data rigor around this. So at the initial intake conversation, the link worker completes a survey with the permission of the client, anonymized survey, by the way. There's no sharing of names or situation or anything like that. So we protect the privacy of the client, but we collect data about their situation, their interests, and their medical interactions. So how often have they seen their doctor in the last 6 months? How often have they been to ER? And with their permission, we will do a follow-up survey with each person. That way we can have some comparative data as well.
Yeah.
We can also collect the attendance. We strongly encourage our SPECS clients, if they do attend a recommended event, to say so to the person or the organization that's putting it on, so that we can keep track of that. Some of the events, of course, are held at the Waterfront Heritage Center, so it's easier for us to count people.
Yeah. Now, there are some benefits, obviously, for social prescribing, and you've given me 3 lovely bullet points, but I'm wondering if you can elaborate on those. Personal development, social engagement, and empowerment. So I'm wondering who would like to speak to those.
Go ahead, Janet.
With social engagement, I think people feel when they have a chance to be in person with people, they feel a lot better about themselves. You know, it gives you a chance maybe for a little while not to be concentrating on your problems, sharing stories with other people, just having fun. I mean, the drum circle was fun. We're going to be singing next week. So, you know, that's the idea. If they can get out and just relax, maybe have some fun for a little while, maybe meet somebody new that they can talk to.
Yeah.
I think there's also sometimes a learning component. In the early in the new year, we'll be having a paint party with Upwards Art, and a lot of people have never tried that. And we're looking at in early January a theater workshop with the Chiotti group.
Yeah.
So again, this may be something somebody's never tried, and that way they can broaden their horizons that way.
Under the empowerment bullet, the phrasing really captures me. Social prescribing empowers individuals to be co-creators in their health journey. And the last phrase, fostering hope and optimism for their future. You know, seniors often, as their life changes, their health changes, have a challenge with that optimism and you know, feeling hopeful. How many people, or have you had participants? I'm not sure, you mentioned clients. I'm not sure if that's the official term. Have you had? And what have you learned from them, and anything that surprised you as you're going through this?
Well, one of the individuals I spoke with had experienced the loss of her life partner. And as you can imagine, this is traumatic enough in itself. And this was some time ago, but still she was adjusting to the changes that entailed. And as you know, certainly in our own friend circles and even family circles, we've seen people go through a trauma such as that. They've got to deal with, you know, all the financial and the paperwork and all of those sorts of things. They may even change where they live. And on top of that, it goes over months and years. And what I've noticed from people that I have spoken to within the program, that there's been a lot to deal with. We know even from the COVID isolation situation there, where people of all ages had to deal with everything changed, disconnection. And I think certainly for seniors, and 55 plus allows for a wide age range. And it doesn't really matter at what age you need to face huge changes and emergencies. You've got to seek out the supports that you need, get the treatment that you need. But then you look around and you say, what am I going to do with myself? Mm-hmm. So I guess that's what I have noticed with some of my calls. People are looking for answers and aren't quite sure where to look when it comes to non-medical things.
Yep. Janet, how about you? Anything that surprised you or you didn't know about but came forward as a result of the program starting?
Well, this is all new to me, and I'm not one of the link. I'm not doing any of the link work here. I attend all the meetings and keep track of the money.
That's good.
But I also look at the events, and one of the things that we're doing is we are also going to participate in some of these events as well, so that we can see it, see the, how people are enjoying them, what can we do differently, what kinds of things people would enjoy doing. We figure if we might enjoy it, other people might enjoy it as well.
Exactly. Tell me a little bit more about the cultural opportunities that you might have for individuals of diverse backgrounds. What can you offer, or what would you discuss with them?
Well, when we look at the calendar, which is freely available, and that link is available on the Waterfront Heritage website, as well as the Grey Bruce Ontario Health Team website, as they have been quite supportive of us.
Yeah.
You see a great many things happening. We tend to focus on daytime activities because, particularly this time of year, as you can imagine, getting people out in the evening is physically challenging for everybody.
Yeah.
Also, public transportation is sorely lacking. That's another thing that has come up in our conversations when we ask people, are you able to get there? Sometimes it's no. Even if they're otherwise mobile and that kind of thing. So that's one of the things that came up. So we focus on daytime things. And as you probably already know, library has movies in the afternoons. They have a stitch group, that kind of thing. We've made sure we've connected with some of the churches and put in church events, certainly if they're free to all, and usually they're at no cost as well. And that could be cards or coffee, that kind of thing.
Yeah.
A lot of them are not that specifically focused and organized. It could be just a get-together.
Okay.
Which for some people, that's what they're looking for. Just something really informal, casual. They could drop in. They could be late if that's okay.
Yeah.
And I think that's important if they're relying on other people to give them a ride or that kind of thing.
Yeah. And so that flexibility in the program is really, and interesting that you're already picking up a gap around the transportation.
Transportation. It comes up in almost every conversation.
Wow.
People can't get out on a Sunday.
So that certainly is isolating, actually.
Absolutely.
Yeah.
Absolutely. Yes.
There are some other challenges in implementing social prescribing that you may wish to speak about. And certainly, how can we get more people involved? So I'm wondering if you can talk about, because we want more, right? We've got lots of seniors in our community and we want more to get engaged.
Well, as I said, the Grey Bruce Ontario Health Team has helped us a great deal. And one of the significant ways they have helped is reaching out to the medical providers in the area. As you can imagine, doctors, nurse practitioners, nurses, they're swamped anyway. And asking them to do one more thing is quite a challenge. However, we've been able to convey in certain cases the importance and the ease with which people can simply suggest the referral. And the medical provider simply has to have the client's or the patient's permission in order for them to be able to be referred. In addition, we've had referrals from people themselves, as I've said, and also friends and family.
Oh.
So if a friend or a family member feels that someone that they know is isolated, disconnected, with that person's permission, they could suggest a referral.
So which is really helpful because not everyone has a nurse practitioner or physician. We know that, there are gaps. So you don't have to have that. You can be self-referred or have a family.
Self-referred.
And
exactly.
I can't help but think that adult children who've moved away might find this a wonderful resource if they're concerned about the parent at home who may be lonely. It sounds like a wonderful opportunity. What are some of the challenges? You've talked about awareness and training and how to remove barriers.
I think some people are embarrassed. Some people are feeling, well, I don't want people to know that I'm lonely.
I get that.
It's a hard thing to say, and they may feel, oh, well, I'll just carry on doing what I'm doing and it doesn't really matter. It's non-medical. You see what I mean? So there is a social stigma there. There's a feeling that feeling lonely should be expected at this age, perhaps, which I think is a terrible thing.
Yeah.
It's if the resources are out there for you, let's make sure that you can find them.
And I hadn't thought about that, but you do hear where people, oh no, I don't want anybody to know. I don't want to make a fuss. I don't want to.
Exactly.
Yeah, yes. Absolutely fascinating. I would think that feeling of loneliness could lead to depression. We hear about that a lot in seniors.
Exactly. And I think that's perhaps, and I'm just guessing here, but perhaps for a medical provider, that may be the first clue that they can think, oh, I could treat this person medically, but perhaps as an enhancement to that or in addition to that, I could suggest some of the social connection opportunities.
For those who've started to attend the groups, have you found that friendships have happened or people have started to connect with each other? Has there been any sort of network forming as a result of somebody seeing someone in a drum circle?
Well, we're hopeful. It's because we're such a small pilot project. I don't think we can say that that's been accomplished yet.
Okay.
However, and certainly because we feel that we've learned so much so far and we've been able to accomplish a great deal with a very small team, that even by the end of March, we'll have enough learning and enough data to go forward and make that kind of thing happen, perhaps in a future iteration of this kind of program.
So you're already thinking ahead.
Yes. Yeah.
Well, Janet, your job is going to be there finding all the finances.
Well, we're always looking for money.
Which now leads me to the question I also have. You mentioned about a grant, but this is your opportunity now. Can the community support this program financially? Do you accept donations? Like how can the community help each other in the community?
Well, the museum is always accepts, we're a charity, so we accept donations. It may or may not go to this specific program, but whatever you do is part of the whole, it's a total package because we can then continue on with a few activities, maybe past March, if we have extra money to have a speaker or, just that type of thing. Supplies for an event, that type of thing. Advertising is always a big thing.
Yeah.
Getting the word out is very important.
So certainly as we're talking today, encouraging the community to donate, because they may not think about donating to the museum as a way to help a community organization. But as you say, you do accept donations and it does go to programming, which is really, really important. So What haven't we covered? We've got about 4 more minutes in the program, and I want to be sure to profile your information.
I think one more thing I'd like to say is that we've partnered, as I said, with a couple of other cultural organizations, the Billy Bishop, the Tom, and the library, but other cultural organizations within Owen Sound and the area would be very welcome if they feel that they could put on an event or partner with us on an event that would be appropriate for our Specs clients. And our requirements, as I said, it needs to be free or low cost, and we can work with that, and it needs to be physically accessible. So let's talk. I mean, the Chiotti group is an example of a group that does amazing things, and we chatted and we told them about our program, and they said, okay, let's do a workshop.
Excellent.
So any organization that feels that they'd like to chat with us about partnering, we'd welcome that.
That again is about connecting, whether it's with an individual or with larger groups. It's all about connecting together within the community for sure. What was the initial spark for the museum to even think about doing this? Because when you think about it, it's a unique thing. What's the history?
Well, I think it went back to Zach, who is our curator. His sister is involved with a similar type of program in another city, and he had heard about it. And then Jan Chamberlain, who is our museum chair, she had heard about it from different things. And so it just snowballed, and then we're always looking to see what kind of grants are available. Then you just start thinking, well, maybe we could do something and involve seniors and see what we could do from there, and we got the grant, and then we said, okay, now what do we do?
But I bet it wasn't long until you started with the training and started to move forward and make the connections for sure. Yeah.
And it's very much a person-to-person effort, you know? It's a one-on-one conversation between a senior like myself and a senior who'd like to know what's going on in the area, in the neighborhood.
Yeah.
And then from there, we encourage them to come to an event. It's not going to be a huge, enormous event. Oh. It's going to be somewhere that they might sit next to a person and start chatting.
So it all begins with one-on-one.
Exactly.
I can't believe our time has passed so quickly. My invitation to both of you or anyone else you'd like to bring after March, if you would like to come back on HealthLink and talk about that pilot project term and what, where you're going, you have my email. Please reach out. I'd be delighted to have you back again.
Thank you.
Thank you so much to both of you. And thank you to our listening and viewing audience for joining us here on HealthLink to learn more about programs, resources, and services available to you and to your family. Take care and stay safe. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
With Rogers TV, you can cheer on the home team from the comfort of your living room. We'll head to the rink, the field, the court, or the pitch, so you don't have to. Tune in and cheer on your local amateur athletes on Rogers TV.
When I decided to go back to university, the Children's Aid Foundation of Canada supported me the whole way through. Having been in foster care for so long and seeing how the system can